Hello, my name is Drashko Nakikj. I'm from Columbia University. I guess I'm facing a couple of challenges here. One is that I'm giving the last talk in the session before the coffee break. The second is the mic is not well adjusted to my height, or more, my height is not well adjusted to the mic, whatever you want to take from that. I'll try to, engage. So if I'm kind of away from the mic, please let me know. Okay, and so today I will tell you a story about an online health community that migrated from one social computing platform to another one, and how that migration revealed some important connections between social computing platform features and the behaviors in this community. And then based on that, I will also talk about some design implications. And so online health communities like Patients Like Me, breast cancer, health boards, are getting increasingly popular in the last years. These communities have shown that they have some positive effects on the well-being of the participants in these communities by helping them reduce the stress and anxiety, helping them in coping, and basically giving some information to manage their disease. There are two main reasons why participants actually join these communities, and to obtain social support is the overarching concept, but it's manifested through informational support and socio-emotional support. And informational support is basically related to providing opinions, advices, shared experiences, so that people can learn how to go through the disease. And the second one is socio-emotional support. This is related to providing people emotional support and some sort of companionship in the community. These communities generally feature forums in which discussions happen, and through these discussions, these two types of support are provided and obtained. However, these platforms generally feature these more simplistic forms of forums, which are consisted of someone initiating a discussion and then receiving replies. And as a result, these forums really grow big. They have a lot of discussions, a lot of topics. Discussions grow big. Sometimes they go even to hundreds of posts. And all that really makes participants frustrated. It's really hard to find the information that you want. The making sense of this information becomes hard and cumbersome. And research has shown that this is actually a problem, because if people can access the right information, that helps them with their empowerment. It's like a feeling of being in control of the disease that they want to manage. And so for these reasons, community leaders are motivated to find solution to this information management problem. And so in recent years, many platforms like this on this list have emerged that introduced features that improve this information management. They have more creative ways of knowledge sharing, collective sense making, and access to the information in these communities. And so for these reasons, the leadership in these online health communities is kind of compelled to make a move and try to figure out if they can go to platforms like that have that kind of information management support. However, we all know that different communities of practice have different sets of values, and those values are usually transferred into the features of the social computing platforms. And now the question becomes, are these popular off-the-shelf advanced social computing platforms suitable for hosting online health communities? Are they capable to basically respond to the specifics of the information and socio-emotional needs in these communities? How can they affect the social dynamics in these systems and the well-being of these communities? And so this was very intriguing, and we were very fortunate to have a chance to observe a real-life example of a migration of a health community, online health community, from one platform to another. So we were talking about a movement from Ning, which is well known for paying a lot of attention on the networking of its users, really concerned about the community building inside of it, but kind of less known for having very advanced information management. And then they decided to move to Discourse, which is pretty well known for putting accent on free information flow, information management, but is less popular in terms of having this capability to stimulate dense community building. And so the research questions that we wanted to ask is that, what were the community's values with respect to informational and socio-emotional support provision? What were the members' perceptions regarding the role of different platform features in their ability to obtain and provide informational and socio-emotional support? And then, what were members' perceptions regarding the effects of platform migration on the social dynamics in the community and its well-being? And so we took the qualitative case study approach method. This was done in a self-diabetes management community. It was a very vibrant community, very active, with 30,000 members. Caregivers and patients were participants in this community, and this is like a peer-moderated community. This study was done in the period of 2014 and 2015, at least the data collection. And so we did. We took data from 3 different sources. The first data source was an interview with a community leader, and then the second was a focus group with community moderators. And so these people were a group of people that could speak for their own opinions, but also opinions of the participants in the group. They were kind of key holders of the opinions about the migration. And we also added another source of information, which is 59 discussion threads with over 1,000 posts from 108 very diverse members, regular members, that also treated the migration before, during, and post. And so we put them together. We did some qualitative analysis, thematic analysis, and then there is more details about it in the paper. And so before I go into details about the results, I just want to mention that all these results are based on the perceptions of the participants in this study. We didn't go with our team to actually investigate in detail all the capabilities of these 2 platforms. We're not sure that the leadership of this community has actually exhausted all the capabilities of these communities to adjust to the needs. And this is by no means like an attempt to critique the design approaches of this community. We rather just use them as vehicles to learn something about design on online health communities. Okay? And so based on our study, we have like 3 major themes that emerged. The first one is improvements in information management. The second one is disruption in identity management on close ties. And the third one is changes in the dynamics of the community. And so the overall impression of the participants is that this movement to another platform actually improved the information management in the community. And so improvements in information access were observed by the introduction of a really capable and effective search engine. Information generation was perceived to be much better. Tagging of members and citing other posts was enabled. And then new content tracking was also enabled. People were really able to track what's new and what's old. Information organization improved. Some more granular organization and categorization of the discussion was enabled, as well as some way of community curation by introducing the like button. And so this person is basically comparing the searching capabilities in the 2 platforms. And it says that I have found platform A to be one big PITA in terms of finding discussions. Nothing is linked. Yes, there is search capability, but except for the occasional times when you search, it's so specific that it takes you almost immediately to the post you're looking for. You usually have to do a lot of post search sifting and winnowing. And you still may not be able to track down what you thought you remembered. And this is much easier in platform B. In some cases, it can be jaw-droppingly easy, as in a single click gets you the context that you wanted to reference. These other participants is really impressed by the way you can easily track the content. I can see any new topics added since my last visit, and any new replies to topics I've read or have been following. If there's new replies, it remembers where you last stopped reading, so you don't have to go through pages. A definitely improvement in my opinion. And so this transition, on the other hand, was perceived that hurt some of the community building features, community building capabilities, primarily because of the loss of some identity management and self-expression features, and features that supported building close and intimate social connections. And so, for example, rich profiles were a feature that was really responsible for building, for allowing people to express themselves, to build really personalized pages that describe them, like showing photos, posting videos, saying something on a daily basis. And then blogs were also there, and they were treated as like personal houses where other people can come and join and kind of learn about each other. And then blogs were similarly responsible for self-expression. People were saying their opinions about different topics. Close and intimate social connections were supported by talking groups on intimate topics and being able to friend people and form some clusters of communication. And so this person says about the effect of the personal profiles. Clearly, the personal images in the profiles tell something personal about the users. There is undeniably a bonding effect associated with these personal nuggets people are sharing here. The effect Platform B might be that the OHC becomes just one of those discussion sites where we have more than plenty of. Perhaps some of those abandoned features even make the OHC so special and unique. Have you considered that? This other person talks about the importance of the communication in small groups. And so there are some very personal stories I would like to share. It doesn't feel safe to do so here anymore. The one I would like to delve into in a moment we have posted in the Bernstein group on the old side, a place where there was a baseline agreement on a starting place, no longer explanations needed of where one is coming from. And so here I will talk about the discussion, the changes in the community that were perceived based on this gaining and loss of features. Once again, I want to stress out that this is all based on participants' perceptions. No kind of data-driven specific analysis was done to support what we found with this qualitative study. And so how people perceived the community before the migration is that it was very active, very vibrant, warm and welcoming, a place where people could freely express their feelings and form true friendships. After the migration, there was a shift in this. People felt that community lost some of the key members in this community, and there was perception of drop in engagement and loss of warmth, and some even thought that it's becoming more fact-oriented. And so a really good summary is provided by the leader of the community that we interviewed about the effects of the designs on the community and the changes that were observed. So really the thing is that the guys who created Platform B, they really value the sharing of content and ideas. And the folks who created Platform A really value sharing identity. And so the two platforms reflect that a lot. I mean, you really got to manage your identity to put up pictures of yourself, and you could write problems about yourself or about your family and post them on your profile page and all that stuff. I think combination of the two would be ideal. And so what do these results tell us? Well, first we observed that based on these perceptions that participants had actually a shared understanding of of the values in the community. They perceived it as warm and welcoming, as a place where you go to get the right information efficiently. And then about the behaviors, they also had shared understanding. They all saw it as a place that people go to share identities, build close social relationships. Everybody has a chance to be heard, and everybody kind of trying to provide actionable information for the others. And so, after the migration, the participants also were able to find connections between some features and the behaviors in the community. So rich customizable profiles and blogs were responsible for building this social identity, and then friendships and communication in small discussion groups was responsible for building close social relationships. And this is pretty consistent with what the research on participants' engagements was talking before. However, what was very interesting that during this process of migration and before, things were not that apparent. For example, a small discussion in small closed groups was perceived as something that was limiting the communication and kind of restricting the information flow. However, after the migration, it was really revealed that these communication small closed groups are the ones who are building these social close relationships and are very important. Similarly, some features had unintended consequences. For example, these similar discussion starters were supposed to eliminate redundancy, and posts of 20 characters with less than 20 characters were supposed to kind of provide more engagement in discussion, like make the information more accessible. However, these were perceived as something that hurts the building the social identity and close social relationships. Like people were perceiving starting a discussion as a way to say something about themselves. They used these short posts to update the measurements that they were taking, like reporting their self-monitoring. Use them as social games and kind of for emotional support. And so we also observed that there is a lot of context dependency in these features. So members' badges and likes are usually a feature that is supposed to stimulate engagement, kind of recognize the information as valued by the community, and therefore surface it for being easily be accessed. However, in our community, it was perceived as limiting the chance for everybody to be heard. It's kind of some sort of elitism was introduced, and exclusivity. Same for close group communication. In some communities, this is perceived as preventing the free flow of information, and closed groups are not that valued. But then in our case, it was shown that these are really important for holding the community together and building close social ties. And so there are two main design implications that come from here. First one is that these associations between behaviors and features in these communities is really hard to find. It's not trivial. So we have to find some computational methods like integrating utilization logs of features, text mining, social networks analysis, to come up with some kind of computational tools that will help us to find these mappings, and then use those mappings as probes to learn more about the community. Like in our example, if people could sense that, if there was a way to sense that there is a lot of updates and utilization of the personal profiles, then that could be a trigger that these things are really important for the community. Same way for close group communication. If there was a way to recognize there is a lot of communication in these groups and like a lot of positive sentiment was shared, then we could think that that's really important for the community. Second, these features are really context dependent and a lot. So we have to have tools that will enable these communities with very little skills to adjust the platform to the needs of their members by turning off and on certain features, adjusting some parameters and things like that. And so it will really increase the ability of online health communities to adopt to the platforms and evolve over time. And if really they have to move somewhere else, well, then they could pick the place that the new home in a better way. And so this study had a few limitations. It was relied on member perceptions, perspectives on members who joined the community prior to migration, and there could be some other factors that are unrelated to the design of the features that influenced these perceptions. And in conclusion, I want to just say that we really have to pay attention to having balanced information and social support in these social computing platforms for OHCs. And then monitoring tools that will be able to detect those connections and platforms that can help us to really easily tweak these platforms to be suitable for the specifics of online health communities' needs. I want to thank the people on this slide, my advisor Lena, my committee member Noemi, Arts Lab members around the room, and reviewers and so on. So I will open it for questions.
We have time for a couple questions.
Hey.
Hi, David Carger, MIT. You talked about how some of the characteristics of the new platform worked against what the migrants wanted. Was this unavoidable? Like, did they sort of look around and find what they considered the best potential platform to migrate to that had the character, or were they making sacrifices because there were other sort of other things that they were weighting more?
Right. So the motivation for the migration was majorly driven by this kind of increasing concern that people were not able to find the information that they want. Also, that community was not providing like the technological support that was needed. They didn't have really skilled staff that can do advanced adjustments and things like that. And so they actually went and talked to some consulting companies to help them with the choosing of the platform. And they really did a survey of things. It was not like a random pick, which was, in a way surprising that there was kind of lack of methodological approach how to do these things. These connections of features were really not, apparent. Like the relative importance of the social building features relative to ones that provide information management was really like probably not well. And I'm just guessing. So they made this move, and then only after they made this move, they kind
Then
of
they discovered.
saw what was going on.
Got it. Okay.
So
Thank you.
Thank you.
If there are no more questions, if you have more questions, I'm sure authors, speakers will be sticking around for more questions. But if there are more, I want to thanks again for all the speakers today, and thanks for everyone being here. Thank you.
Thank you.